To the Shadow Health Minister, Mark Butler, and to take us there, here was the Chief Medical Officer, Paul Kelly, on the concerns about the number of children being admitted to hospital with COVID.
Almost entirely, the disease in children is much less severe than it is in adults. So that's an important component. We have seen some hospitalisations in that age group. Most of those have been in New South Wales, and most of those have been for social reasons rather than because they are severely sick. But there will be, and there has been, some more serious cases of COVID in those age groups. So vaccination, very important.
Mark Butler, welcome to the program.
Thank you, David.
So the national plan involves reaching 70 and 80% vaccination of over 16s. Should 12 to 15-year-olds be included in those targets before restrictions are eased?
I've been very clear, as have a number of premiers, that 12 to 15-year-olds who are now eligible for the vaccine should be counted as part of the national plan. They have really become the front line in this disastrous third wave. They account for a third to 40%, if you include under 12s as well, a third to 40% of all new cases. And although the disease is less severe than for adults, in adults you might see 1 in 10 COVID patients ending up in hospital. Still 1 in 30 teenagers who catch COVID is ending up in hospital. This is a very serious concern for parents, and parents deserve an answer to the question, when will our children be vaccinated?
But, I mean, just to ensure there's perspective around this, we just heard the Chief Medical Officer say, yes, a lot of those kids, they were there for social reasons, i.e. their parents are having to go to hospital, so they have to go to hospital. He says the disease in children is much less severe. He's not alone. Sarah McNabb's the Director of General Medicine at the Royal Children's Hospital in Melbourne. She says COVID's terrible in adults, particularly the elderly, but children, very mild illness, the vast majority are doing really well. That perspective is important to point out, isn't it?
Sure, but I talk to parents who have children with COVID, and for many of them it's been a very, very severe disease. And as I say, as many as 1 in 30 are ending up in hospital. The other point, obviously, is that they are infectious if they get the disease. So in terms of slowing down community transmission, this is an important part of the population in ways that they weren't necessarily in the previous variants of the virus. That's why I've said 12 to 15-year-olds should be a very urgent focus of this government. In the US and Canada, they started vaccinating 12 to 15-year-olds in May. In many European countries, in Israel in June. 60% of 12 to 15-year-olds in Canada are already fully vaccinated. Not one 12 to 15-year-old, as far as I know, is fully vaccinated here in Australia. So if they're not part of the national plan, if the Prime Minister continues to refuse to count them as part of the national plan, at least parents deserve an answer to the question, what will the vaccination position of our 12 to 15-year-olds be as we move through these phases of the plan?
Let me ask you your position then. Just to be clear about this, are you saying it's not safe for New South Wales to end its lockdown until we get to 70 or 80% of 12 to 15-year-olds being vaccinated?
Well, no, I've said, as have a number of premiers, that they should be counted as part of the 70 to 80% thresholds. If they're eligible for the vaccine, other groups are only really getting eligibility for Pfizer vaccines now. If 12 to 15-year-olds are in the same position, what is the argument for not including them? They get the virus, they can get unwell, they can pass it on to other people. So why are they suddenly cut out? And if they are cut out, parents want to know how many of their 12 to 15-year-old children will be vaccinated as we move through the next phases of the plan.
Okay, because the Doherty Institute modelling says including those 12 to 15-year-olds, quote, would not materially change the expected overall health outcome in its plan. So,
well, it will change the health outcome for those teenagers.
So you disagree with the Doherty Institute's modelling?
Well, they're two different answers. They're two different questions, David. It will change the health outcomes for those teenagers.
No, we want to see the health outcome. Just to quote what the Doherty modelling is saying, it would not materially change the expected overall health outcomes.
No, I fully accept the Doherty modelling, and I have since it was first released.
So do you support the national plan, or do you think it should be changed along the lines you're suggesting this morning?
Well, I support the national plan because, all of us want to see an end to these chronic, debilitating lockdowns as soon as possible.
But you seem to, sorry to interrupt, you seem to have a fundamental difference, though, with the plan when it comes to including those kids in the targets.
Well, I said 12 to 15-year-olds should be counted, as did a number of premiers. Now, if the National Cabinet doesn't take that view, then we need to get on and implement the plan. But I think if they're not counted...
Sorry, your view right now is, do you support the national plan or not?
Yes, I said I did, David. Going into Friday, I and many others urged the Prime Minister to consider counting the 12 to 15-year-olds as part of the national plan. That was not the decision. So we need to work with the plan we've got. But I do say that Scott Morrison needs to tell parents when their 12 to 15-year-old children will be vaccinated. If they're not counted as part of the national plan, at the very least, he needs to make a separate commitment to parents. This is when your children will be vaccinated.
Yeah, and look, plenty will no doubt agree with you, but just to be clear one more time on this, you support the plan, but you would still like it changed.
No, David. The chance was to change it on Friday.
Okay,
if the
that's
Premiers and the Prime Minister didn't take that decision, well, we've got the plan and we need to implement it. We want to see an end to these lockdowns as soon as possible. So let's get on with a debate about implementing the plan safely, and that will be our focus. We've supported every step of the response to the pandemic. Our focus has been the degree to which the Prime Minister has been able to implement those plans properly, effectively. He's bungled the vaccine and quarantine phases of the response. We don't want him to bungle this phase. There will be devastating health impacts if he does.
Look, ultimately, a lot of this does come down to a question about what level of serious illness and indeed death we're willing to accept. And look, obviously everyone wants that to be as low as possible. But can I ask you what you believe is acceptable? Perhaps not necessarily a certain number, but are the numbers in the Doherty model, are the numbers we're seeing in the UK, what sort of level is acceptable?
Well, first of all, there are different numbers in the Doherty model depending on particularly the effectiveness of our trace and track systems, and that has been the major focus of my contribution to the debate. If they are not maintained at optimal effectiveness, we will see thousands and thousands of additional hospitalisations and many hundreds more deaths. That's in the model. And our trace and track systems are already starting to break down, particularly in Sydney and to a degree in Melbourne as well. And the only Commonwealth contribution to that has been the COVID Safe app, which is completely ineffective, unlike in other countries like the UK, where an NHS app, a nationwide contact tracing app, is absolutely central to an effective trace and track system. So there are different numbers, and that's why, for us, that is the first test of the safe implementation of this plan. The second test would be making sure no group is left behind, particularly vulnerable groups like Indigenous Australians who have an appallingly low vaccination rate right now, people living with disabilities and others. And the third is to deal with this question of 12 to 15-year-olds. If we can meet those three tests, then we will have a safe implementation of the plan. But really, I think people are entitled to question Scott Morrison's ability to do that, given the degree to which he's bungled his other jobs this year.
Mark McGowan, we just saw, doesn't want to, in his words, deliberately infect people in his state by removing border restrictions. When do you think states should be opening their borders?
Well, I think Phil Curry made the point in his introduction that the plan doesn't actually mention border restrictions explicitly. It says that all states will start to lift restrictions as vaccination rates rise, and then says that those precise restrictions are still to be determined. But there are two very different experiences being lived in Australia, as we know. In some states, New South Wales, Victoria and the ACT, there are heavy internal restrictions. In other states, there aren't really any internal restrictions at all, but there are hard borders. So bringing those two experiences together, I think, is the real challenge of National Cabinet.
And that's what I'm asking. Well, just for your view, I suppose, is it at that 70 or 80% of the entire population being vaccinated? At what point should they open the borders?
Well, 70%, for example, still means that 6 million adults are not vaccinated and some millions of children aren't vaccinated as well. So if there is a sort of exposure to the full force of the Delta variant, you are going to see very, very high case numbers and hospitalisations. And premiers in South Australia, WA, Queensland and Tasmania are going to have a pretty close eye on that.
So what should be the point?
Well, I think 70% is going to be very difficult for states that don't currently have COVID suddenly to fling open the borders. And I don't think their people will allow the premiers to do that, and I don't think that will be the public health advice that they get from their state chief health officer.
So what should the point be?
I'm not going to nominate a particular. I'm not going to nominate a particular percentage. National Cabinet hasn't even nominated a particular percentage. The point I make is that this is a moment for the Prime Minister to lead, and I think it's clear that so many of the premiers don't feel that he has had their back through this period. He's supported Clive Palmer's challenge to border closures in Western Australia. We see revelations yesterday that Gladys Berejiklian regards him as evil and a bully and would prefer
Right, so,
Peter Dutton to be in that
you'd
position.
like him to put a
This
number
is a
out
moment
there.
for him to lead,
Okay, you'd like him to put a
than call
number.
people cave dwellers.
Okay, but you're not, just to be clear, Labor's not going to suggest any sort of point at which the borders should open.
Well, National Cabinet hasn't suggested a particular number. There is much work to be done between the Premiers and Chief Ministers and Prime Minister. We all want them to do that as soon as possible, but it's a moment for the Prime Minister to lead rather than continuing to divide the states.
Now, New South Wales is making vaccination mandatory for teachers, for childcare workers, and even if you want to spend a bit of extra time outside during the lockdown, you've got to have a vaccination. Do you support this sort of approach?
I do. The precondition to it, of course, is that everyone has access to a vaccine. Still in Australia, too many people who want a vaccine can't get one. These are supply problems that go back to poor decisions by Scott Morrison last year. But once everyone does have access, I think that although it's a choice whether or not you get vaccinated, there will be consequences to your choice. I think, though, there are a couple of other conditions other than supply. The first is we've got to have systems in place. There are already widespread reports of people's vaccinations not being uploaded onto their register. This is going to be very critical, not only just to get access to go to a pub, for example, but if this is a condition to getting into an aged care facility to see your mum or getting into a hospital if one of your loved ones has a car crash, then this is very serious. Those systems must work properly.
And just on
and
that,
obviously,
sorry, you have no problem with pubs, restaurants, other venues requiring proof of vaccination?
No, I think that's where we're headed. I think we've got a strong view that that is where we're headed. I think the Prime Minister's going to have difficulty carrying his party room on that already. There are a number of coalition MPs who've said that they'd cross the floor, but we're up for that debate.
Labor's happy to go down that path.
We're happy for that debate, but you know they've got to have better systems in place. We were shown last week that the Medicare app can be forged in as few as 10 minutes. So there is some systems work the government needs to do, and obviously there will have to be exemptions in place for people who have genuine medical reasons not to get vaccinated.
Final one on booster shots. The World Health Organization says it's actually more important to vaccinate poorer nations that haven't even had a vaccine yet than it is to give booster shots in wealthy countries that have been vaccinated. They've likened this to giving life jackets to people who already have life jackets and letting those who don't have one drown. What's your view? Should Australians be given booster shots when some of our poorer neighbours haven't even had a vaccine?
Well, I don't think it's an either-or approach for a country like Australia. We should be doing as much as we can to support the vaccination efforts of our neighbours.
I mean, that would be ideal, but just to come back to what the World Health Organization is saying, ultimately there's only so many doses going around. Should we get boosters before others get a first go?
We've ordered enough to do both, and I want to see those come through. We are going to need booster shots. We're seeing in countries that were way ahead of us in vaccination efforts that the immune response of the vaccines does start to drop, including the Pfizer vaccine. So, you know, we do need a strong booster program here, but that shouldn't detract from our efforts to support countries overseas.
All right, Shadow Health Minister Mark Butler, thank you.
Thanks, David.